So this is my demonstration for a subcutaneous injection. Sub-Q injections are used for insulin or heparin. For this sake, we're going to say that I am administering insulin to the patient. So first I'm going to get my needle, which is a 29 gauge. And that works because for insulin, you can use between 28 and 31, so that works just fine. And then here I have my practice insulin and then my injection pad. So first I'm going to open up I'm going to first clean off the vial with a alcohol swab. Okay, so I've cleaned it off. Then I'm going to open up my needle here, and this is a 0.5 milliliter needle, so we're going to administer, say, 30 units. Okay, so I'm going to fill it up to the 30 with just air, and then I'm going to inject that into the vial. I'm then going to fill up the needle back up to the 30. And I'm being careful not to get any air bubbles in it. All right, that's pretty good. All right, so as you can see, there's no air bubbles. It's up to the 30. I'm going to then put the cap back on for now. And then I go into the patient's room, knock, knock, introduce myself. And then I'm going to perform my third check. I've already done my first two out of the room. So my third check is going to be making sure it's the right patient, the right route, the right dosage, and right time. And so I'm going to be checking the patient's ID band to make sure it's the correct name, date of birth. And then I will scan it with the MAR, make sure that all matches up. Once it does, I will ask them where they would like the injection, because for subcutaneous, you can get it in the abdomen, the upper outer arm, the anterior thigh, or the upper back. So let's say this patient wants it in the abdomen. So I will don my procedure gloves. And then I'm at their abdomen. I'm going to clean off the spot where I'm going to inject it. And I'm going to wait for it to dry. Once it does dry, I am going to open my needle here. I'm going to pinch up the skin. I'm going to be holding the needle here like a dart. But I'm going to make sure I'm not injecting anything before it gets into the skin. So I'm going to pinch it up. Then I'm going to inject the needle. And then I'm going to inject the insulin. Okay, then pull it out the same angle that I took it out in, and I am going to, for this sake, I won't deploy the safety because this is my last needle for insulin, but I would employ the safety, and then I would discard this in the correct bin for hazards and needles and all that. And then I would dab off any blood, I'd give a Band-Aid, and then I'm done. And I take off my glove and perform hand hygiene, and then I'm done.